You have tuned into The Voice of Medicine, the medical podcast filled with remarkable stories, first-hand experience, important research, and valuable life lessons. Open your mind, relax, and enjoy. Hello everyone and welcome to another edition of The Voice of Medicine. Today we have a special guest from the US, Los Angeles. Right now, night hours over there, but nevertheless she took her time to talk to us. Heather Linden. Heather is the director of physical therapy at the UFC. So for those of you who don't know the UFC, it's probably one of the biggest worldwide known martial arts associations. Bringing up names like Ronda Rousey, even Conor McGregor, Khabib Nurmagomedov, George Saint-Pierre, and many more, with basically venues all over the world. She is in charge of the physical therapy, and I'm going to discuss with her how this works for the UFC. She used to work for the US Olympic Committee. We're going to speak about that time in her career as well. We will speak about different kind of injuries and issues that the athletes have and how exactly Heather and all the other members of her team are helping the athletes. And I hope you're going to enjoy the talk. Heather, welcome. I'm very happy that you made it on my show, although I know that right now in Los Angeles it's quite late already and you're probably tired after a day.
No worries. I love being on your show, and I'm super excited to chat with you guys tonight.
Heather, you are an expert in the field of physical therapy. You worked with the United States Olympic Committee, and now you're the director of physical therapy for the UFC. Now, I think, at least in Europe, if you would ask anybody on the street if they know what physical therapy, or as we call it here, physiotherapy, is about, the majority of the people will tell you that it has to do something with recovery, right? With rehabilitation. If they had an accident or something like that, they go to physiotherapy and then, they get better, recover, and then are normal, can regain the normal functionality. But I guess there is much more to that, right?
Absolutely. There's a lot more to it. I would say, especially in an athlete population, there's a lot more to it because not only are we doing recovery and rehabilitation, but we're also looking at prevention. We're looking at day-to-day maintenance therapy, trying to make sure the athlete can perform at their highest level and make sure that they're healthy and able to function at the best capability possible.
Taking the focus of prevention and keeping athletes at their best possible level of performance, can you tell us something about that? So maybe let's start with the prevention focus.
So at the UFC, which is very similar also what I did at the United States Olympic Committee, is when we first, have an evaluation with an athlete, we're looking at prevention. So what we do is a full orthopedic screening. We designed our own customized orthopedic screening, kind of making sure that we were hitting all the areas that we thought we were seeing injuries occur. So we evaluate the athletes from head to toe, looking at big asymmetries, looking at big strength deficits, big range of motion deficits, in order to look at more of a preventable injury rather than being reactive after something has already occurred.
Okay. So based on this assessment, you can sort of already see what could happen in the future. But I guess this not only during training, but also maybe during a fight. Did I understand this correctly?
Yeah, absolutely. So not only are we looking at, injuries that can occur during training, but also injuries that occur at the fight, we're able to then classify, past medical histories, injuries that have occurred previously, and really start to, find the trends that are affecting these athletes. By doing these full evaluations when they're healthy and at baselines, we can kind of see, where the body's going to break down. And then we can take that. And, in a combat sport, there's always factors that you have to be prepared for that you can't account for. You know what I mean? But at least the things that we can account for from a musculoskeletal standpoint and making sure that the athlete's body's functioning as properly as they can, we can look at those areas to kind of, look at the trends in injuries. What is happening in the fight versus what is happening in training? Are they overuse injuries or are they acute injuries that are happening each fight that they do?
Can you give us some specific examples of what you and your team already discovered that is basically happening to a large number of athletes that you're trying maybe to circumvent already?
Absolutely. So, with our team, we've started to classify overuse injuries from a training perspective. We're looking at a lot of athletes that have neck injuries, especially when they come from a grappling background.
Mm-hmm.
We look at athletes that, are in jujitsu and they're having more ligament injuries, whether knees or wrist or things like that are kind of being cranked on a little bit more. So they're getting more of that type of injury. And then we can kind of put it together and look at, is a grappler fighting somebody that's more, a jujitsu, or are they both strikers? And then we can kind of classify how those injuries are. With striking in the octagon, we see a lot of like facial injuries, lacerations. We see possible concussions, things like that. Where if it's more of a jujitsu based fight, we're going to see more of a ligament damage. If it's more wrestling, we're going to get neck, we're going to get some shoulders, we're also going to get some lumbar spine. So really, depending on how the fight goes, we're starting to be able to classify more and more of the injuries we see and be able to kind of back up and see how we can prevent these injuries.
So there is a clear link between each one of the martial arts and basically the strategy that the martial arts utilizes and the injuries which can happen and that you are trying to prevent, yeah?
Yes, we definitely see trends depending on the way the athletes come up in mixed martial arts. If they're big grapplers, we see a certain trend in injuries. And we're actually being able to prevent a lot of these now and really look forward to train the athletes to go into the fight with prevention being, our number one goal.
Now, you worked for the Olympic Committee before you came to the UFC, and I assume back then you also worked with different kind of athletes, or did you have a specific sports category that you only worked with?
Yep, I worked with the U.S. Olympic Committee for about 6 years. I was based out of our Colorado Springs facility, which is more combat sports. So, yes, I worked with all, 50 different types of sports, but both summer and winter. But I would say my biggest focus was every day I was getting, to be very familiar with our combat sports. We had all three disciplines of wrestling that were based out of that facility. We had men's gymnastics, we had boxing. Occasionally we'd have taekwondo or judo come through there. So a lot of our combat sports, would filter through that Colorado Springs location. But I also worked with everybody else. Leading up to the Rio Olympics, I was put with swimming. The last Olympics filtering into South Korea, they placed me with figure skating. So honestly, I've seen all different aspects of sports, and really being able to see the trends in each and every one of them, I think has made me a better clinician than I am today, focusing just on the UFC population.
Yeah, this is exactly why I asked, because I was thinking, well, if this is happening to UFC fighters, that you see these trends, according to wherever the background they're coming from, this must be probably also as an analogy used to the other Olympic sports. So and as you explained it is the case, and I guess this also probably really prepared you for the job that you're doing right now. So it's a perfect fit, right?
Yeah, it's actually a pretty funny story. When the UFC contacted me about this new performance institute they were building in Las Vegas, and they were looking for clinicians and a director of physical therapy, my first reply to them was, I really wasn't that familiar with UFC. So, the athletes that came through there, the Hall of Famers, me being really not that familiar with the names. But when they started breaking down, the various mixed martial arts sports and how familiar I was with each injury that occurred, more of that grappling wrestling background or more of the striking, kicking, they were like, our sport more than you ever thought. All the injuries based on the individualized sports, that came through. And that I think made me, a unique fit for the UFC to hire me there.
The UFC in the very beginning, nobody knew what it is and what it will become, right? I mean, it really actually, grew into an empire.
Absolutely.
Really worldwide. I mean, when once I was in a tram here in Zurich, and I heard two older ladies discussing the McGregor fight with Khabib, and I thought that this is impossible. I mean, that's not really the viewership that I thought that UFC will have. But so
No.
this is how big they are. Bring this completely new segment into sport and entertainment. You're working with UFC fighters now, which are, incredible athletes, but you worked with Olympic athletes. And would you say there is a difference between these two?
Yeah, I definitely think there were. Like, I would say my US Olympic athletes were kind of filtered through a process where, they're identified at an early age, as very athletic and, very good at their sports. So they're kind of filtered through a process, of being around medical providers, being around physical therapists, being around strength and conditioning, being around nutritionists, sports psychologists, mental health, exercise physiologists. So they're very familiar with that. And when I started the job with the UFC, I kind of was like the big red X on the where athletes were unsure if they told me things, if they would be pulled from a fight. They really weren't quite sure, what my respective role and job was. Was I, for the UFC and could pull them from something, they were really concerned about telling me about their small little injuries. And, that was the biggest difference I saw between the athletes was just being familiar with a performance-based team behind you versus athletes that are just used to kind of pushing through it, grinding it out, where I think honestly, in the 2.5 years we've been open as a facility, I think it's been a huge change in the way that our athletes look at us. And, we're a young sport. We've only been around 25 years. But now it's flipping into that performance-based sport, which is something I don't think we saw previously in the UFC, where we did see in the Olympics. So, our Olympic athletes are used to saying, you're overtraining. Let's track, your progress of your loads every day. Let's see where the injuries are occurring. If you're not quite feeling right going into practice, then stop by and see your physical therapist so that they can, help you out if you have a neck that's stiff from the night before or a small strain in a muscle from the practice before. So I think that's the biggest difference. It was culturally trying to teach these athletes that, we are here for them, and having a performance team behind you only ensures that you're healthier, really helps you become a better athlete all around and improves the longevity of sport for you.
So how did you approach this, you and your team, to sort of, give the athletes a familiarity feeling so they knew that you guys are there for them, and sort of bringing their game, up a notch with your scientific and professional expertise?
So when we first opened, we really set back hoping that athletes would come to us. And I think quickly within about a 4-month time frame, we realized, we started brainstorming and saying, how can we get these athletes to trust us? How can we get these athletes to, understand that there is a science behind this, that could really help them out? And one thing we decided as a team was to put some of us out on the road. So, one of the things we said was, here we are trying to back up these athletes and really help them. But the time when it's most necessary to be there is the time of competition or the time right before competition. So we started traveling our medical team as well as our sports dietitians, and being there for those athletes the week of a competition and the day before and that day of, I think really flipped the viewpoint of the athletes, realizing that we were there for them. And, we are an athlete-centered performance institute, and what their needs are, they come above and beyond anything else. And by getting out, I had an athlete once, my first trip on the road, that was literally, I will never go to that performance institute, blah, 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 blah. Like, they invested all this money, live there. And, after a full session with me and we worked on some of these small little things that were bugging him, he was like, where are you from? I would love to move and train where you are because I feel the best I've ever felt, going into this fight. And I, just simply chuckled and I said, I am your physical therapist at the Performance Institute. You have free access to me. I'm also on the road to help you guys out. And he just stopped suddenly and was like, you let me just gripe about, this whole big Performance Institute being built and we'll never use it. And now here I am, you've made me feel the best I've ever felt walking into that octagon and being able to perform at my best. So that started switching, I think, the mentality of our fighters, just having these one-on-one experiences, gaining the trust, being there at the time of need when they really do, need a performance team behind them. And by doing so, I think that really started switching that outlook. The athletes started becoming more and more familiar with us. And then from there, I think in this last 2.5 years, it's really opened the doors. These athletes that said they'd never come through a performance institute are now the ones showing up on our doorstep saying, hey, I injured myself. I'm going to stay here for 2 to 6 months so I can do rehab with you guys. Or can you really get me on track from a diet standpoint and a nutrition standpoint on how I could be safer with my weight cuts and how I can look at this from a year-long standpoint rather than just one fight.
So it was the hands-on first-person experience that changed their mind and trying, compared to, for example, trying to convince them.
Absolutely. Absolutely. And I think, we see that in healthcare in today's age, when we see a lot more concierge medicine, we see a lot more, of people that really strive to have that one-on-one contact with their clinicians of all different kinds of providers. We are service providers in the end. And I think sometimes we lose sight of that because, insurance companies, drug companies, other things that, can guide us down where we don't have quite the quality time with that individual. And I think it's the same exact thing in sports as well.
Yeah, absolutely. This is something where a lot of physicians that, we talk on a daily basis are complaining about that simply they don't have the time anymore to spend with the patients, explaining them certain things, maybe even let them talk for a moment so they actually gain more insights of whatever is going on in their lives. So their therapy and their approach to the patient can be, better and in the end more efficient. So just by taking more time, maybe saving the trouble later. Yeah.
Absolutely.
So we talked about a little bit about the prevention focus. And you also mentioned that you guys are helping the athletes maintaining a very high performance level.
Yep.
I guess that's also a little bit different in how you do it and who is involved in all this. Can you tell us about that?
Yep. So we have a pretty big team. Well, I say we have a big team, but there's only probably about 14 out of the Vegas facility, and then there's about 14 or 15 out of our Shanghai facility. So we're a small team, but really stacked. And what we entail is a sports medicine department, a strength and conditioning department, a sports dietitian department, an exercise physiology department. And then we're looking to expand that more into a neurocognitive department. Mental health area is kind of our future in the next year or so. And what we all do is we get athletes that come in and we do full profiling on the athletes from every department. So whether it starts from a nutritional aspect and they're doing DEXAs, they're doing metabolic efficiencies, resting metabolic rates, whether they're transitioning into the sports medicine, doing orthopedic screens, baseline concussion testing, functional movements, transitioning into strength, looking at power, speed, strength, transitioning into exercise science, looking at VO2 max, lactic acid, alactic testing. Pretty much what we do is we do a complete profile of the athlete so that we have a really good understanding. And then really we meet with the coaches, their medical teams, their strength teams, and we look at, what is the goal for this athlete? Is it they need to improve from their strengths? Are they weak? Is it they're having issues with their weight cuts? Is it they're chronically injured? And then whoever is like the most important in that team takes the lead. So if it was an injury base, I would take the lead. If it was more nutrition, our director of nutrition would. If it's, a strength and power, our strength and conditioning team. If it's more exercise physiology, they look at it. So we do all of this under house. We meet with everybody. We give them all the scientific objective data. And then really it's up to the team to decide how they want to use that data and how to use that to increase their performance. We've had athletes that have come in and, their coaches say they win their competitions because of their strengths. They're going to focus on their strengths. We have others that say they feel they lose competitions because of some of their weaknesses. So we all sit down as a big round table. And that's, one thing that I can really say we're really good at the Performance Institute is having a multidisciplinary, interdisciplinary approach on every athlete we see, and it's completely athlete-centered. And we're not making the, decisions whether, hey, you're going to go in this octagon and do this. We are not MMA coaches. We are just there to give objective science data to figure out what their coaches, what their teams can decide on how to use that data to improve them long term.
One of the reasons why I was so excited to talk to you is, we as spectators only see the fights, right? Maybe we see, a couple of these promotional videos of the buildup of the fight and the press conferences, but we have no idea about all this work in the background done by you guys.
Yep.
And I have to say, from everything that you're telling me, that's just incredible professional level that you put out there every day with these athletes. It's so much work and it's incredible professionalism. So, respect at this point. It's lovely to hear how much effort is actually put into these fights on those fight nights.
Thank you. I really appreciate that. And one thing I can say from that is, it really is, our mission is to change the sport of MMA. And when you look at it, it really was a sport where you only knew about the fights. You know what I mean? People would view the fights, and then sometimes athletes would not even train after the fights until they get that next call where they sign, for their next fight. So we're really transitioning that into a full-time sport rather than just a fight to fight, way of looking at things. And I think that's where we really can cultivate this MMA world and change it and make a longevity and make this sport transition like any other professional sport in football, soccer, baseball, anything like that. You'll really see, I think, this sport grow even more exponentially than it has in the 25 years it's been around.
Another topic I wanted to ask you about was, for a long time, UFC was male only, right? Domain. It was male-dominated world. And I think Dana White, back in the days when they asked him if he can imagine women fighting, he said something like, hell not.
Right.
But, with time, he changed his mind, and then I think Ronda Rousey was one of the most famous UFC fighters, period, getting gigs in movies and so on. Then later on, people like Jacek, Cyborg, and so on came. What's your opinion about women in the UFC?
Yep. So, it's pretty crazy. Somebody once told me this recently, is we are the only professional sport that starts our men and women exactly at the same rate. So it's a huge step in the right direction, in sport in general. We're seeing a lot of discrepancies between salaries, male versus women, in other professional sports. And truly here at the UFC, they are started at an equal value. And depending, obviously salaries go up, negotiations go up, things like that with managers. But really, truly, we really love that we can treat them equally from a male woman. And I think the evolution of female UFC is just on the rise up. I mean, recently we just had 2 women that were the main event that occurred a few weeks ago. We're really seeing a lot more sponsorships and things happening in the women MMA, and really having true leaders that are world champs that are, in the women's division. We're seeing the women very popular, a lot of really fan-based. We're also seeing them incredible athletes, true mixed martial artists that we're really not seeing that big gap between the male and women's sports, which I think is a really huge thing that you don't see in other sports for us.
If we should quickly draw a bridge back to physiotherapy and the male-female difference, do you see, are there major differences in how to approach the athletes depending on if they're male or female?
Yep. I would say from an injury standpoint, the injuries are very similar.
Okay.
The injuries are, if we have our females that are more grapplers, they still come to the same injuries with, cervical spine issues, shoulder issues, striking. You're going to have more of the elbow, kicking, things like that. But really, truly where we see the biggest difference is going to be more on that nutrition aspect, weight cut aspect with hormones. We've had a lot of women that we are now getting that have had weight cut issues where, they've been amenorrhea or they've already started becoming somewhat osteopenia just because of the body differences in that sense. And I think that's our biggest thing, from strength and conditioning and physical therapy, the injuries are very similar. The injuries from a musculoskeletal standpoint are very much equal between male and female. But I think from a nutrition standpoint and making sure, bone density, everything like that is on par, that's definitely where we see our biggest differences between the men and women.
I mean, you're very experienced in this field, and I would like to know your opinion about this cutting weight, right? I think this is one of the biggest problems that we all, like, we hear it a lot of times.
Yep.
If people follow sports and martial arts in particular, they hear that this is, for a lot of people, a big problem, yeah? And
Yep.
it has been done, I think, for a very long time the wrong way. A little, dummy question is there a right way how to cut weight?
Right, right. Coming into this world, I've had the wrestling background of seeing wrestlers cut weight and having to make weight, how that the rules changed where they had to make weight now the day of. When I first came into UFC, my mind was blown that, males could lose 15 to 20 pounds in a week and women were losing 10 pounds in a week. And really, my medical background tells me, is it really safe, But taking a step back, learning from my sports dietitians and how smart they are and how, if it is done in a correct way where, nutritionally wise, you've set the body up for these weight cuts, there's a lot more science behind it than people actually know. We recently had an ESPN injury analyst come shadow us for a fight week. And their mind was blown about how much science and stuff there is. The problem is in this population, before we came along, there was a lot of people doing it without a science background. So not knowing, what that athlete was eating, what they were fueling with themselves with, and pretty much just doing starvation and then trying to do a dehydration on top of that, which wasn't successful, and you would see bad results on that sense. But now that we're really getting a hold of the science background and really understanding, our sports dietitians have it down to each day they're calculating the amount that can be reduced and dropped down. And then that's completely recalculated on when it comes to the rehydration stage, how to rehydrate so that, the liquids go in first. And everything is really scientifically driven, which I think is something that the general population doesn't know about. They only hear the really bad, just like any kind of media, they love to hear the big stories. But there's a really big science background, and I think it's improving as we go. From a physical therapy standpoint, there's a ton of research I look forward to doing. There's some people in Australia, there's some people other places as well that we're looking to do more of that scientific background. Do you see dehydration, balance issues, muscle issues where, they're not being activated correctly or they fatigue faster? Those are all things that are still yet to be out there and really study. And I think that's where we are going to go down that path, and really learn more about it. But I think, really there's a huge scientific background on it that the general population don't know about. And we just hope to continue to evolve to make it as safe as possible.
Yeah, I guess it's completely right what you said. It's, for most, it's about the safety of the athletes and not undergoing health risks unnecessarily before the fight,
Right.
Which usually can also backfire in the fight, right, if this is done incorrectly.
Absolutely.
But I'm happy that you guys are working on it, trying to use new scientific methods to get them prepared. Now, speaking of specific methods, there were two things I wanted to ask you about. First was electro-stimulation from your physiotherapy perspective. If you could tell me if you see it as something valid or good, or how to use it. And then the second thing, I saw, and maybe this is also a media perk, I don't know, you have to correct me if I'm wrong, but a lot of athletes are also using cold and heat to recover or to get up in their performance?
So first, starting off with electrical stimulation, when I was in PT school, we were taught, electrical stimulation is really used for our pain. It's the gate control theory, the opiate control theory, is it chronic pain versus acute pain, how it can shut off the pain receptors. Mostly from a clinical standpoint, I've had the best, I would say, result when it comes to more hands-on approach. The times that I'll use neuromuscular e-stim is really when it's an acute surgical patient who's having difficulty contracting muscle. I tend to use more a hands-on approach when it comes to other issues, unless they can't tolerate hands. So if it's an acute issue and the athlete can't do soft tissue, cupping, dry needling, other things, techniques that I've seen better results, then that would be something where I'd use the electrical stimulation. But I find in our clinic, we usually use it the most for more muscle activation, turning on a muscle that is unable to fire. That's when we're going to use the electrical stimulation. Otherwise, if we can put our hands on them and get increased blood flow, get the joints to move properly, get the tissues to be in good condition, we tend to use that route a lot more. We're not very modality driven. We mostly use everything hands-on from that aspect. And then the second question, I'm sorry, repeat yourself, was?
It was a cold heat therapy
Cold
or
versus, yep.
cryotherapy. I don't know. There's a lot of things going on.
There's a lot of controversy right now when it comes to cold and hot. I tend to stick to the basics on that. We have athletes that will use contrast. Pretty much what I use the most is, if it's cold, obviously we're going to get vasoconstriction. If it's warm, we're going to get, everything's going to be enlarged. Mm-hmm. And so pretty much when I work with athletes, I look at what their body systems are. What are we trying to achieve? There's a new thing that, cold is so bad. You want the inflammation to occur at acute injuries. You don't want to use cold if you're at a hypertrophied stage in strength and conditioning. Honestly, I really think it's dependent on person to person, athlete to athlete. Mm-hmm. I had an Olympic athlete that used cold baths every night. And when the newest research came out that you shouldn't use it because he's trying to, build muscle and bulk up, and he's like, oh, I'm not going to get that because they're telling me cold is going to shut that off. Well, he stopped using the cold baths. And he couldn't even train the next day because he was so sore. Mm-hmm. So in the scheme of things, I said, for you, you really perform better when you do that vasoconstriction after you've had a full day of hard training. And this prepares you the next day in order to train better. And, we really got to look at it. It's quality versus quantity. If you can train better because you did a cold plunge and you vasoconstrict and your body feels more recovered, then go down that avenue and use it. We use a lot of cold and hot, especially if we're trying to pump a lot of stuff out of their bodies. So if they've had a hard training, they maybe have a small injury, but they feel stiff. I like to use the contrast cold and heat. And if it's more injury, I like for them to finish on the cold. But if it's more just stiffness and tightness from, working hard, then I have them finish on the warm so that they feel good and they feel more mobile afterwards. I also will sometimes, if they have a second practice that they want to come back to in the afternoon, maybe have them finish on the warm. So I really think it's dependent on the athlete, and it's also dependent on, what their training load is and what kind of quality of training they're doing. I do agree with the newest research saying that cold, will shut off the inflammation and you won't get that hypertrophy that you're looking for when you're doing a strength and conditioning phase of that. But I also will say from a personal experience, I've had athletes come in recently and been like, oh, we didn't do ice and compression on a new acute injury because the research is saying this now. And that athlete take double the time to get better. I truly do believe that ice and compression, like a game ready, is a great adjunct and a great modality to use for when you have an acute injury to shut that off. Because I look at it as you get an acute injury, you get that spike of inflammation, and that's a good thing. Yes, I agree with what that research says, but you don't want that spike of inflammation to keep going, where then it's going to take you several days to get that inflammation out and get that joint moving correctly. So I look at it as, yeah, the inflammation has already occurred because the injury happened. Now let's control that, manage that. Let's get the joint and tissues moving because the body loves to move. And, I see that with all injuries, even on every common person, when you're injured, you feel sluggish, you don't want to move, mm-hmm. but the body really does well from a musculoskeletal standpoint if you can move through it. I hear it all the time in back injuries, I can't get out of bed, or the athletes are like, oh, I couldn't train. The minute I get them moving, the minute I get the muscles activated, I get their core stabilizing their lumbar spine, that pain goes away so much faster than someone that doesn't move. So, in the scheme of things, I think cold and hot are very useful. I think contrast baths can be great for athletes. And I think really you got to look at, again, athlete-centered and what the purpose is, and then decide on the appropriate modality for that athlete.
Well, thank you very much for explaining this to us.
No problem.
Heather, while you were explaining all this, I thought, physiotherapy, is so, I would say, underrated sometimes, at least from what I hear. Now, from your own perspective, do you think
Yep.
physiotherapy compared to medicine is recognized sufficiently, or is there still a lot of people saying, sort of pseudoscience, or not really? I mean, we studied med school,
Yep.
we know better. What's your
So
experience?
my experience, honestly, is physicians in general are really don't have a lot of knowledge of what physical therapists do unless they've worked on a sports team where they're one-on-one with a therapist. I think, we had physicians that came through and did rotations at the U.S. Olympic Committee. And I remember having neurologists shadowing me, and I had known him from years prior. And he was like, gosh, I wish I had a physical therapist like you that not only can do wound care, tissue quality, mobility, joint mobs, functional movements, rehabs. I've been trained in taking stitches out. I've been trained in draining ears. At the Olympic team, I was also trained in doing blood and things like that. So there's a lot of things that I think a lot of physicians don't really know exactly what physical therapists do. They think we count to 10 and only give our patients like exercises to do, where there's a lot more that physical therapists can do. I can't tell you, even in my elite sports that I've worked in, how many surgeons are like, oh, you don't need to start physical therapy for like 4 to 6 weeks because they think we only do exercise. And then I get that athlete and that joint is swollen and warm and not moving and inflamed. And now I have double the work. And if that athlete had come to see me day 3, day 4, I'm not going to move that extremity where I'm going to hurt that surgery. I've been trained in all these surgeries, how you can push it, where you feel the tissues, but I'm going to reduce that inflammation, control and manage that pain of that person, and get them so they're on the right track sooner. So when I get them at 4 to 6 weeks and I can start the exercises, they're already past all the tissue issues. And I think a lot of physicians don't really realize what we do. And not that it's their fault. They've just never seen it or never been trained in it. They've only been told through med schools that we do X, Y, and Z. So I'm really fortunate because coming from the Olympic background, we had standing orders where we could do a lot of things, and we were trained in a lot of avenues, almost like physician extenders all the time. So almost like a PA, but from a musculoskeletal standpoint, where I would help, our doctors do injections and do all this other stuff. So we've been trained in a lot of things. And I think, unfortunately, a lot of physicians don't really know that unless they're really close with their sports medicine teams.
So from what I hear, what is required in the future to change this is more communication between medicine and physiotherapy as such, and perhaps more cooperations in where it's possible. Okay,
Absolutely.
Heather, thank you very much for taking your time. One last question: who is your favorite fighter? I mean, if you can say, I know you're not allowed to have favorites, but
So I am not allowed to have favorites. And actually, honestly, I don't. I can honestly say there's not one fighter that I have not met that really has been a huge integral part of my life, changed the outlook that I have from a sports medicine standpoint, and only wanted to improve this sport. I've had great, great experiences with all of my athletes. So having a favorite, I can't say that there's one that I particularly gravitate to. Every day that I get to work with them is truly a delight, and every single one of them has touched my heart in some way, for sure.
thank you very much. Wonderful words.
Well, thank you for having me. I really appreciate it. And anything I can ever chat with you or talk to you guys about, I'm very open, and I love to, have an open conversation.
It was my pleasure. Likewise. Thank you, Heather.
All right. You have a great morning over there.
This was The Voice of Medicine. Make sure you tune in next time and take care.